morning, Andre.
Doc, good morning. So, first, I want to say good morning to everyone. I'm Andre. I'm a VFit specialist here at Victory in Motion. And I just want to welcome you to Dr. P's, or got a problem with your knee? Ask Dr. P. Who is Dr. P? Well, he's a board certified orthopedic surgeon, sports medicine specialist, regenerative specialist, founder and CEO of Victory in Motion. And he's here to answer your questions about knee pain. Be sure to join our group. Got a problem with your knee? Ask Dr. P and submit questions, and then we'll answer them live every Wednesday between 9 and 10 a.m. Good morning, Doc.
Great. How you doing, Andre? Thanks for the
Good.
intro, and thanks everybody who's out there.
So it looks like we got quite a few questions brought in over the week, and there were some pretty good ones. So let's just get right into it. Today, we want to know.
What is arthritis? Well, arthritis is when the cartilage on the end of the bone wears down. So let's use the knee, for instance, because you have your femur, your thigh bone, and you have your tibia, your shin bone, and the knee bends and straightens like that. Now, on the end of the bone, kind of like the white on the end of a chicken bone, if you've ever seen that when you're eating a chicken wing or something like
Yeah.
that, there's cartilage, and the cartilage is that white, shiny, smooth stuff, and it's kind of like the tread in a tire. And so when that tread wears down, when the articular cartilage, the cartilage on the end of the bone wears down, that's what arthritis is, pure and simple. Now, there's different types of arthritis. There's osteoarthritis, which is just wear and tear arthritis. As you get older, your cartilage wears down. Our body has less ability to heal itself and repair itself as we get older, and our bodies start to break down faster than we can repair ourselves. That's something that we try to counteract when we do regenerative medicine programs and procedures like we do at Victory in Motion, home with knee repair, not knee replacement. But there's also different other types of arthritis. There's arthritis where your body can attack itself. That's called an autoimmune disease. Lupus is a pretty well-known autoimmune disease, but also rheumatoid arthritis. So rheumatoid arthritis, your body is actually attacking its own cartilage and causing it to wear down. There are different medications nowadays that are used by rheumatologists who are arthritis specialist doctors or your primary care doctor, but that will cause cartilage to wear down. If you get an infection in your knee, the infection can dissolve and wear down the cartilage. If you have a motorcycle accident or a traumatic injury where you injure your knee, you can damage that cartilage and it can wear down. There's a lot of different things that can cause the cartilage to wear down, but by far the most common is your standard osteoarthritis, which is your wear and tear arthritis. So that's basically what arthritis is.
And what would you say makes your arthritis get worse, especially with osteo?
Yeah, so great question. So osteoarthritis, the wear and tear arthritis, which is the most common arthritis, what makes it get worse is we know that well, first of all, genetics has plays a part for sure. So some people are just more prone to wear out faster than other people, and there's not a ton we can do about that right now, but there are promising gene therapies, especially for building muscle and things like that. There's a gene therapy called follistatin, which actually we have access to in the clinic overseas called the GARM Clinic that we are affiliated with in the Caribbean and on the island of Roatan. It's beautiful. So there's certain things that can be done in other areas of the world that aren't quite available yet in the United States. But there's no gene therapy yet to prevent arthritis. But someday we're going to figure out what the gene is that for the people who have really good durable cartilage, and we'll be able to modify the gene genetics of the person who's more prone to arthritis, hopefully proactively, and prevent arthritis in the first place. So something that we have to look forward to. But for the time being, genetics plays a part, and there's not much you can do about that, unfortunately. But what you can do is we know that being overweight will lead to a higher risk of arthritis. There's plenty of studies that show that. We know that not eating a good diet, so if you're eating an inflammatory diet where you're eating a lot of processed sugar, you're eating a lot of fried foods, you're eating a lot of seed oils, those are things that cause inflammation in your body. And inflammation is not only damages your heart, causes cardiovascular disease, causes diabetes, causes cancer, but it also damages our joints. And so if we can get on an anti-inflammatory diet, maintain a good weight, that can help slow down the arthritic process. But if you're overweight and you eat a poor diet, that's going to accelerate it. Same thing. Your muscles are your main shock absorber. Our muscles absorb most of the force when we walk. When we walk, we land with about 3 or 4 times body weight force going through our knees. So our muscles absorb most of that force. But what our muscles don't absorb, the cartilage on the end of the bone has to absorb. And the cartilage on the end of the bone is kind of like slow compression rubber. It'll absorb force. But as that wears down, then more and more force gets transmitted to the bone underneath. And the bone has millions of pressure sensitive nerve fibers. So that'll give you pain, but the bone also will start to break down faster than the body can heal itself. That's called a stress or a microfracture. And not only is that painful, but then there's less support. If the bone's softer underneath the cartilage, that cartilage is going to break down faster. So we want to maintain strong muscles to absorb that force, so less force has to get absorbed across the cartilage, especially if it's starting to wear down, and then thereby reducing that force on the bone, which can lead to worsening arthritis if you develop these stress or microfractures, these soft spots under the cartilage. People who get those are about 9 times more common to go on to need a knee replacement than people who don't get those stress or microfractures. Those are things we treat with bone marrow cells and things like that that we can get into. Other things that can lead to worsening arthritis, unfortunately, are injuries. So we see ACL tears quite a bit in the athletic population that we deal with. And if you tear your ACL, which is the main stabilizing knee to prevent your knee from giving out when you cut and pivot, like playing soccer or basketball or football or volleyball or any cutting or pivoting sport, then you have a 50% chance of getting arthritis within 4 or 5 years if you do nothing. If you undergo an ACL reconstruction, which is the traditional way of making a new ligament, taking a piece of your kneecap tendon or your hamstring tendon or a cadaver, dead person tendon or your quadriceps tendon, drilling a tunnel and making a whole new ligament, that's called an ACL reconstruction. You still have a 50% chance of getting arthritis, but it pushes it out 12 to 14 years. So now we have this BEAR surgery, bridge enhanced ACL restoration or repair, and we can sew an implant in between the two torn ends, and it stays there for 8 weeks and then slowly dissolves, and it allows your own ligament cells, nerve fibers, blood vessels to grow across that area to heal that ACL, and that will hopefully lessen the risk of arthritis. But injuries, motorcycle accidents, fractures where the bone breaks into the joint, any type of injury can lead to an accelerated arthritis. Now, people always ask me, can running give you arthritis? And there's no studies that prove that running can give you arthritis. Maybe ultra marathoners that had a slightly increased risk that I remember from any of these studies out there. But if you do have arthritis and the cartilage is already wearing down or worn down, then yes, running and impact loading exercises may not be the best exercise and can cause that knee to start wearing out faster. It doesn't mean we can't develop a program to help you do those things, even if you have arthritis, but it's not necessarily the best exercise to do. So I hope that answers that question.
Yeah, just going to interject my own question. So, what are your suggestions for someone who does have pretty significant arthritis, but they want to stay active? Maybe they're not really into the weightlifting things. They like the more cardiovascular stuff. People, when they think of cardiovascular, they're going to think right off the cuff, the treadmill or running, right? So if we don't want to keep having that impact on those joints, what kind of cardio would you suggest for those people?
Yeah, absolutely. I'm a VFit specialist in care of people, not just their knee, but their whole body. And you said cardiovascular, right? You want to take care of your cardiovascular system. So that keeps you healthy. And if you have a good cardiovascular system, you're going to pump nutrients into the areas like your joints and stuff that need the nutrients, and it's going to wash away the bad stuff. So having a good cardiovascular system is huge. And riding a bike is one of the best cardiovascular exercises you can do. And it's very quote unquote knee friendly, meaning you're not pounding on your knee. You're not adding to the wear and tear. And if you have arthritis, it's a great exercise to do for cardiovascular and also for strengthening. The ergometer or the rowing machine is very good as well. We love to use that. It's not bad either because elliptical, you're really not pounding. So most people who have arthritis can still do an elliptical. Swimming is outstanding. And running, putting an aqua jogger on, and going in the deep end and water running is a low impact exercise. So there's lots of things you can do, but I'd say, getting on an exercise bike or getting on a regular bike, that's probably the most common thing that people do and that we do. And you ask you this question early in the rehab process, do we allow people to ride bikes most of the time?
Well, it's a few things, right? It's time, it's criteria, and usually we want to wait a few weeks. And we want to make sure that they're starting to have less swelling in the area and things like that. We want to make sure they have good range of motion, right? Because you have to have a certain amount of range of motion to let that pedal go around. So it is a little bit different for everybody, but you check the boxes to get them back to where they need to be. And we don't you always err on the side of more cautious than anybody because we know beginnings of things, even like the bear, we're a little bit slower, but we make up for that on the other end as long as everything is done correctly.
Right. So post-surgery, it's have to have, too much pain. They have to have adequate range of motion to, be able to turn the pedals and not too much swelling because you don't, which means it's inflamed and the knee's not happy. And, depends on what the surgery is. You have to allow enough time for the ligament to heal before you start getting them on a bike, things like that. But for the cool thing is for our regenerative procedures where we're injecting bone marrow cells either into the bone or into the knee or into both, what would you say the quickest we get people on a bike usually is on average?
I think the fastest I've put anybody on a bike is up like weeks out, depending on how they are, right? Because there's other factors too, right? What if they're doing MLS laser? That's gonna also kind of up that swelling and inflammation dying down and pain too.
Yeah, I've seen you guys get people on a bike even sooner than that. That. So again, it depends on how the person's doing. Everybody's different, and I think this just leads to the fact that we do personalized programs and it's not one size fits all. It's not a cookie cutter. It's
Yeah,
not like, oh, you're going to be on a bike in 3 days or you're going to be on a bike in 3 weeks. It's going to depend on factors,
yeah,
including time, knowing how biology, how people heal, how natural biology works. We can speed it up a little bit by using laser and in regenerative medicine and things like that. But Mother Nature is still Mother Nature, right? And
exactly.
then also, how is that person doing? How is their knee? How is their body behaving? If there's no swelling, there's full range of motion, they have no pain, we're going to get them on that bike a lot quicker. If they have a
Definitely.
swollen knee, they can't get they can't even bend their knee to 90 degrees. If you can't bend your knee past 30 degrees, you're not going to get around on, you're not going to be able to ride the bike, right?
Yeah,
Physically. So all those things are really important. And that's another thing, like getting into a pool. Once, let's say, talk about if you have an incision, you're going to have that healed before you get somebody in the water in the pool. But
right.
if it's a regenerative medicine procedure, there's just little poke holes. Usually, a week to 10 days, we can get people in a pool, and in some ways, that will help the swelling go down. And it doesn't matter how much range of motion you have and all those things. So everything's different. But to answer that question again, those are all really good cardiovascular exercises, and a bike is probably the number one tool that we utilize.
Yeah. I because you brought up the bear, I just want to segue over to that just for a few seconds. And I just wanted to know how does the bear differ from the traditional reconstruction?
Right. So again, Bear is bridge enhanced ACL restoration. So we're keeping your own parts. We're sewing a collagen implant that looks like a packing peanut. It's made out of type 1 collagen, which is the building blocks of our soft tissues. It actually comes from cows. They purify it. And so there's little to no, I've never heard of anybody rejecting it or having an allergic reaction, but I guess if somebody was allergic to beef, you'd want to know that, but I haven't heard of that. So it's less invasive surgery than an ACL reconstruction, and it's sewing an implant in between the two torn ends of the ACL so that the ACL can grow back and you keep your own parts. An ACL reconstruction is different. It's basically shaving away all of what your original parts. It's drilling some tunnels that are about a centimeter, a third of an inch wide into the bone, and then taking a strip of your kneecap tendon, your patellar tendon, or your quadriceps tendon, or some hamstring tendons. So taking tendons and trying to turn them into a ligament. And so we take the tendon and we drill a tunnel and we put secure it into position where the old ACL used to be, which, pretty darn good at that. But do we always get it 100% perfect and put it in the exact spot where God put it originally? It's not easy to do that.
Yeah.
We get close, But the advantage of the bear is those attachment points, which were there when you were born, they're still there. We're just sewing something in between to get that thing to heal. So the reconstruction is making a whole new ligament, and then you have to, you take that tendon out. It's basically dead. It's cut off from all its blood supply. So you have to put it in there, and it has to get a blood supply has to grow back into it. Blood vessels have to grow back into it. New cells have to grow into it, and it has to turn from a tendon into a ligament. And that process can take, up to 2 years biologically. That doesn't mean people have to wait 2 years to get back to sports. Although, if you really look at it, that probably would be the safest thing to do. As much as people don't want to hear that, waiting 2 years to get back to sports would be probably the safest thing to do. And you have a lot less re-tears, recurrent tears. That goes for the bear or that goes for a reconstruction. But that process takes a while. Now, this with the bear, it also takes a while. It takes about 8 weeks for the two ends of that ligament to reconnect, and then it's still weak. And then after that, it takes a good 9 to 12 months for it to kind of where we like the way it looks on an MRI. And if you looked at it under a microscope, it would look like a healed ligament. But even that can take 18 months to 2 years to look fully normal again. So it takes time. And we try to speed it up a little bit, like you alluded to, with using a laser, which increases blood flow, decreases inflammation, stimulates the mitochondria, the little powerhouse of our cell. So, like the batteries of the cell. It also helps with pain, but also adding stem cells. Bone marrow has stem cells and other cells that help the stem cells, adding stem cells and PRP, which is kind of like miracle growth. So, trying to speed that up. We don't have any long-term studies on if that makes a difference, but over time we will have those studies, and I think it's going to help speed things up. But I think there's still going to be other things on the horizon we don't know about that will speed those up. So the bear is a repair, keeping your own parts. The reconstruction is making a whole new ligament, usually from a part of your body, and using that, but you can take a cadaver, a donated part. And then the recovery is about the same, usually 9 to 12 months to get back to sports. The re-tear rate, if you're in your teens or in your 20s, it may be as high as 25%. As you get older, it's a lot less. So overall, the re-tear rate is probably around 5 to 10%. But when you're younger, it's much higher. And so we have to be a lot more careful with those people. The thing about the bear is the knee feels more normal. It's a less invasive surgery. Interestingly, when you do a reconstruction on somebody, they're actually just as apt to tear their opposite knee ACL as they are to re-injure the knee that you did the reconstruction on. And we think that's because the nerve supply to that ligament that you reconstructed isn't as good, so you're still relying on that other knee. We don't know this for sure. But when you do a bear and you keep that your own ACL, you're actually a lot less likely to tear the other knee, which is a nice advantage. And then also, if you are one of those unfortunate people who tear your ACL after you've had a reconstruction or a bear surgery, if you've had the bear surgery, you can still undergo an ACL reconstruction and you'll still do very well. Whereas if you've already had a reconstruction and you have to have a second reconstruction, that's a lot bigger surgery, a lot less successful, and a lot harder to come back from. I think Odell Beckham Jr. is a good example of someone who had that happen to him. He played wide receiver for the Giants. He tore his ACL. He had a reconstruction. He then came back, played for the Browns for a little while, did well, but then he was in the Super Bowl with the Rams. He caught a couple touchdown passes. He retore it, and he's never really gotten back to where he was after the second reconstruction. So the bear kind of you one step ahead if, God forbid, you re-injure it, which can happen if you're going to play football, right, in other sports. And then the holy grail is really trying to prevent arthritis. So, like I said, if you get an ACL reconstruction, it doesn't prevent arthritis, it just pushes it off. Whereas with the bear and the pig studies, the animal studies, it looks like it prevents arthritis. In early results, clinical results look like in humans that's going to be the case as well, but we don't have those fully published studies yet.
Just a quick aside. I know for myself, I tore my ACL when I was 17, so it was like 90s, in the 90s. I didn't have a hamstring. It had to be, I don't know exactly what it was. It's either quad or patellar tendon. Um, and I just know for me, like, it was a lot different back then for the rehab, right? Like, I remember going to physical therapy a couple of days a week, and they were like, okay, you're gonna do, it was like 6 week checkup. And I remember my therapist saying, well, don't worry if you don't get cleared today. Most people don't. And I was like, okay. Then I went through legs, leg things like that, and they're like, "Oh yeah, you're good," and I was discharged, right?
So it's
Uh,
6 weeks?
yeah. Then being
Wow.
17, didn't really know. I was like, "Oh, I'm fine." Uh,
Wow.
in the 90s, that's when those big trampolines were starting to be in
Oh
everyone's
my gosh. Yeah.
backyard. I remember I went on one, knee buckled,
Oh,
never got it looked at. And then a few months later, I was walking through a rocky parking lot, knee buckled, and then it was fine for a long time. And then maybe in my early 20s, I stepped backwards on a rock. It buckled again. I was always really nervous about that knee. I never got looked at. And then I got into like powerlifting and I never had any issues. Like my quads and hamstring really took over. But now as I'm years old, I do notice like aches and pains and like swells if I'm on it too long and stuff like that. So just wish technology was out back when I was younger because it would have saved a lot. How long, when you do a bear surgery, how long are you usually in the OR for that?
I'd say the surgery takes it can take 45 minutes to an hour and a half, depending on if there are sometimes even a little longer than that. If there's a lot more damage in there, it depends if there's meniscus tears. So you have your cartilage on the end of the bone, which we talked about, which is the articular cartilage, like tendon. Then you also have the meniscus cartilage, which are the two little shock absorber cartilages in between bones. That's usually the cartilage you hear about. Like an athlete tears the cartilage in their knee and needs to have arthroscopic surgery. So if those are injured in addition to the ACL, it's going to take a little more time. We always try to repair them if we can, put some stitches in them. Sometimes we can't, and we have to just go in and trim out the torn part. There can be other damage to other ligaments and things like that as well around the knee that might need to be addressed at the time of the bear surgery. So I would say the average is about 45 minutes to an hour and a half. And same thing with an ACL reconstruction. I would say the bear in general is a little, in general, though, if you have the same pathology, if it's just an ACL tear, I think the bear is going to be 10 to 15 minutes less in time because you don't have to harvest a graft. So with the ACL reconstruction, you have to take the graft first. You have to strip out a piece of your tendon and you have to prepare it, put stitches in it and all that stuff. And so it takes a little longer to do an ACL reconstruction, but in general, they're not that different as far as timing, how much time it takes in the OR. Bear's a little quicker.
When it comes to arthritis, it has no pathologies of torn ligaments or anything like that. They want to be preventative. Are there things that they can do?
Absolutely. And we kind of alluded to some of this, and even you just kind of with the powerlifting or whatever, right? Getting stronger, having strong muscles is massive. I mean, fat will help you lose weight, right? But losing fat will also decrease inflammation in your body, and inflammation in general is bad. So also being on the right anti-inflammatory diet. We actually, I'm kind of digressing here a little bit, but we have a genetic-based nutrition where we send you a mouth swab. You did it, right? You swab the
Yeah.
inside, did it to you. Swab the inside of your mouth. It goes to a lab. They come back with a 32-page report and it tells what the best diet is for you, but also your micronutrients, what allergies you have, what sensitivities, what's the best exercise for you, all that stuff based on your genetics. And so losing weight, people always say, well, losing weight is key. Well, it's part of key. Part of why is like losing fat's more important than losing weight because you might exercise and gain weight, but you're gaining muscle weight, and that's going to be way better than just losing muscle weight and losing weight. See what I'm saying? So, like,
Exactly.
weight for the sake of losing weight isn't good if you're losing muscle, especially long term, because you need that muscle as you get older. So, losing weight's important, but building muscle is just as important. So, those go hand in hand. Losing fat's more important than losing weight because fat causes inflammation. And so we know inflammation's bad. So, I'd say increasing your muscle mass, decreasing your fat, which does decrease your weight, but more importantly, decreases your inflammation. So, what were you saying? How to prevent? Yeah. So that's one way. Now, we have some patients who do this, but it's rare. There are some patients who will come in and they might want an X-ray once a year, or they might want an MRI once a year because the X-rays can help because you can see if there's the joints getting narrower and narrower. But the MRI is also very helpful because you can't see if somebody has stress or microfracturing on an X-ray. And a lot of times it'll start and the person won't have any pain. And it's kind of going on. And then there's something, the straw that breaks the camel's back, or it gets to the point where it starts to become big enough where it gives them pain and then they'll come in, or sometimes they'll ignore the pain until it's too late as well. But if we can catch that stressor microfracturing before they even have pain, then it's curable. It's we can reverse it. We can get it to heal. So those are things that are not covered by insurance, and they don't cover prevent. They don't even cover the diet part, but exercise and being proactive can help prevent arthritis. And the I just say this, I don't participate with any insurances because insurances doesn't allow any of that stuff. So we are free to do what we think is best for the patient. And if a patient does want to be proactive and work on preventative programs, we're all about that. We've been doing preventive programs, including preventing ACL injuries. There's a program called Sports Metrics. We've modified it. We call it the VIP program or the Victory Injury Program. But we have a program, that can cut the risk of ACL tears by 50 to 75%. If you can cut the risk of an ACL tear by 50 to 75%, you're going to cut the risk of arthritis down the road if someone doesn't tear their ACL. So there's a lot of preventive programs that are not covered by insurance that we've offered over the years, but we still offer. And if anybody is interested in that, we can absolutely help them with all the above because you are what you eat. Diet and exercise is important, but just saying diet and exercise without having a set plan or a well thought out plan or a specific plan for you, like based on your genetics, is kind of throwing, blindfolded. You don't really know. You're kind of throwing stuff at the wall and seeing if it'll stick.
I know we were talking about like foods that cause inflammation, right? And like seed oils and things like that. Are there any foods that actually help decrease inflammation?
Yeah, absolutely. So anything that has the omega-3 as opposed to omega-6. Seed oils have a lot of omega-6, which is inflammatory. So fish oil has oils in it that are anti-inflammatory, salmon, things like that. Sardines are super for that because they're small and they have less toxins in them because they're small fish. Sardines are outstanding. Even
And delicious.
anchovies. Yeah, I love sardines.
I do too.
And so that oil, other types of oils that are less inflammatory. The seed oils,
Avocado
unfortunately, tend to
oil's
be
good.
more inflammatory. I mean, you can talk about red onions, turmeric. There's all kinds of spices. We could put a list of anti-inflammatory foods, but there's a lot. Now, having said that, your body may metabolize salmon differently than somebody else's. So that's why the genetic thing, like me saying this is kind of generic. Me saying this, but after looking at your genetic report, I can tell you exactly what's anti-inflammatory for you. Like you might be able to eat gluten and it might not cause inflammation in you. Whereas if you're gluten intolerant, it's going to cause massive inflammation. If you're lactose intolerant, right? So I kind of generic things because then people kind of onions should be anti-inflammatory, but maybe with your genetics, it doesn't. I think that's where that figuring out what your genetics is first, then we can specifically say, yes, Andre, this are anti-inflammatory for you, and this are inflammatory. Don't eat those things. And you will notice a massive difference, right? Adam, who's
Definitely.
not on here, he talks about it. He never had any known gluten intolerance, but I think once he found out on his genetic report that he had it,
He's
he's a new man. Like
yeah,
he
stays away from it
and
and
then people say, well, I think I'm gluten intolerant. And a lot of times they're not gluten intolerant. It's actually something else in their diet that's causing the problem. Or a lot of people who think they're gluten intolerant and basically the grains in the United States, the genetically GMO grains, and I'm getting a little crazy here, but some of that GMO stuff is not as good as if you just buy Italian or Europe or Italy or to the Italian stuff because I'm Italian. But like if I that and it was grown there, they don't have all that GMO in it. And it even with the gluten, there's different types of gluten.
yeah,
So some people who are supposedly gluten intolerant are not gluten intolerant when they eat the pasta or the bread that is made
extra
in from
additives.
another, yeah, have all the additives and all that stuff in it. I mean, a lot of those chemicals that are put in the food in the US, and hopefully this gets changed, are inflammatory in and of themselves.
Yeah.
So
Yeah.
it's the genetic base works really good. I think you look at there's an app called Yucca, Yuka,
Mhm.
and you can pretty much scan any, yeah, Yuka. You can scan just about any food, and it'll tell you if it's good, bad, or ugly. It scales it
Oh,
on a 0 to 100.
Hmm.
And so 100 is obviously the best and 0 is the worst. And it's really amazing how you can look at different things and it will tell you if it's good or bad. Family Farms organic sushi rice, excellent. Instant long grain brown rice from Wegmans, excellent. I'm just looking at some of the ones. Hot cocoa mix, Ghirardelli, poor. Not surprising, but so yeah, you can really look up a lot of different things on that app and you'd be surprised at different pastas. So the Italian pastas I looked up on here were excellent, rated. But if you look at some of the American ones, they're not excellent. So
That
Yucca
seems
is
like
really it's a cool app for looking at that type of stuff because it looks at if there's additives and all the other stuff
yeah.
in.
That's actually a great resource, and I'm probably going to add that to my phone. My wife and myself, more so my wife, and I'm kind of following her lead. She started cutting out gluten. My report came back. I had a little bit of a gluten intolerance as well, but she has gluten, and then she's trying to get rid of the seed oils too. So, like, a lot of labels, and like you find a lot of gluten-free stuff, but everything is with the seed oils.
Crazy,
I
right?
went
Yeah.
one day I spent 10 minutes at Wegmans and I was just looking through all their gluten-free breads to find only one out of every one gluten-free, and they used olive oil.
That's wild. So how have you tried it?
Yeah, it was good. No effects from it.
Awesome.
Because when I got my report back and it said I had a gluten intolerance, like I've been eating gluten all my life, it doesn't bother me, right? And then I had my meeting with Coach Kelly, and she said, moderate, but was either you're pregnant or you're not. So, gluten out, and then I reintroduced it once, right? And instantly, stomach was hard as a rock, felt uncomfortable.
Isn't that amazing?
Yeah. So here's the other part of that though. Holidays roll around, all that. I started eating it. I felt kind of like crap, but over those few months, and then I noticed like I do it, right? Like I
Right.
just know I
So
still feel that way, but I
right.
just don't notice it anymore. So I just started fasting and stuff and getting back on my DNA.
Yeah, so there's a thing called epigenetics as well. Like based on my genetics, I'm supposed to not like bitter things, but I love
Yeah.
black coffee. I love red wine, especially like cabs, things that are more tannic, which is more bitter. Dark chocolate. So you are what your is like, but your epigenetics are how your genetics are expressed. And you can change your epigenetics for the good or for the bad.
Yeah.
And so the epigenetics are how your genes are expressed. And different genes can be turned on or turned off. And so you sometimes do adapt. If you were starving and you had to only eat stuff that had gluten in it, your body are amazing at how they adapt. But ideally, if you are gluten intolerant, it's probably best to be off it.
Yeah.
But there is epigenetics, and our bodies are amazingly adaptable. And what's happening in your case.
Yeah. And one last, I know we're for the knees, but I do like this kind of things that we do as well. But I do know that, I was talking with Adam. He said he removed gluten for a long period of time. He got a personal pan pizza, had one slice, felt really upset stomach and everything. The next day, he stepped on the scale and he was 5 pounds heavier. And he actually reached out to Coach Kelly, and that doesn't even make sense. And she said, you're looking at it as calories in, weight gain, but it was really the inflammation.
Yeah,
So,
retaining. Yeah, for sure.
right. And then, back to knee pain, right? That inflammation is putting all that pressure back on that. And then,
Absolutely.
so I got some more questions. I know I got a little sidetracked there. When it does come to arthritis, how is heat affecting arthritis?
So heat is something that is going to dilate blood vessels, so increase blood flow. Heat, as long as it's not too hot, also gives a pleasant feeling. So you've probably heard of a TENS unit. A TENS unit uses electrical stimulation to confuse the nerves that are going back to your brain, to overload the nerves that are coming from a specific region where you're having pain that are going back to your brain. So your brain gets distracted by the electrical signals on the skin and it forgets about the pain inside the knee, for instance.
Mhm.
So it's kind of the same thing. You put a warm pack on there, it's going to make the skin feel pleasant, and those are going to go to your brain, and it's going to distract your brain from the pain inside your knee. So it does help with pain. It can help with pain. It can help your knee feel better. It's not getting to the underlying, it's not doing anything for the underlying cause. It's not growing back new cartilage. It's not curing or healing the stress or the microfractures in the bone, but it will increase blood flow to the area. So when you increase blood flow, the area kind of warms up and it makes it looser, makes your tissues more pliable. So if you have stiffness, a lot of people have stiffness, they'll put warm packs on to kind of get their knees moving, able to stretch them better and get going. Because unfortunately, when you have, when you don't move a joint, it gets a little stiff. And that's why when we wake up in the morning, we stretch and whatever to kind of move it again. But when you get arthritis, that stiffness is even worse. And so it takes even longer to get going in the morning. So putting a warm pack on might help you, feel better, help your pain, make things more pliable and move better, increase the blood flow, get the blood flowing. But it's not going to do anything for the underlying cause or cure the root cause.
What about things like massage, acupuncture? Do those have
Well,
any
yeah.
benefits?
And back really quickly on the heat thing too. If you have an acute injury or your knee's really swollen, it might not be best to put heat on there because increasing blood flow may cause a little bit of an increase in swelling. So that's where ice comes in. Ice is better for you overdid it and your knee is swollen. Ice is going to decrease blood flow and decrease swelling and decrease inflammation. It's not going to do much for getting your range of motion back, but if your knee's swollen and your swelling goes down, that's going to help your knee get range of motion back. So they they can kind of each other sometimes, but usually heat before exercise, ice after, usually heat for chronic pain and stiffness, ice for more acute or more recent pain and stiffness. Acupuncture and chiropractic, you said?
Massage.
Massage. So it would not be around for thousands of years if it didn't have efficacy or effectiveness. So, and I don't know a ton about it, so I'm not an expert at acupuncture. I have had it performed on me a couple times, and it is pretty amazing how it works. So I believe in it, and it's just that we don't have a lot of acupuncture providers around us where we can, but I do think it absolutely can help with decreasing inflammation, increasing blood flow, decreasing pain, increasing range of motion, lots of other areas, kinds of different areas that it can help with. Is it going to grow back new cartilage? There's no evidence that it shows that it does that. I bet you, and I don't know this for sure, and I probably should know this or look it up, but I bet you there are certain things you can do acupuncture wise, which probably release growth factors. That I probably almost say
That's
yes.
interesting.
But also, are there certain acupuncture things that can maybe increase the production of stem cells? I don't know that, and I'm not an expert at that, but that might be something we can look up and or get an acupuncture expert on at some point in time to talk to on this, which I think would be helpful.
Yeah, I think
Massage. I mean, say like if you get a massage when you wake up in the morning and a massage before you go to bed at night every single day for the rest of your life, you'd probably live an extra 10 or 20 years, right? But not nobody, most people don't have a personal massage therapist who can work on them, day.
yeah.
So I believe in massage. I believe in it, thing. It's going to increase blood flow. It's going to decrease, it can decrease pain and swelling, can open up the lymphatics. I mean, massage, there's kinds of different massage, right? Even you experts, PTAs, PTs, athletic trainers work on certain types of massage to get lymphatic massage, right? To get
Mhm.
swelling, et cetera, out of an area. So massage is definitely a piece of the puzzle. And if anything, and even heat and sometimes ice, all these things can help release dopamine, and dopamine makes you feel better. And so if a massage releases dopamine in your brain and makes you feel better, you're going to forget about your knee pain or whatever. So it's correct positive effects, and it can have indirect positive effects. Now, if someone had a surgery, like a bear surgery, you don't want the massage therapist kind of going crazy on the knee and doing some of the stuff that, you have to be careful. But if in general, I think most massage therapists, people who go to them for their arthritis pain, et cetera, and their stiffness and everything, notice temporary relief, And again, it's not going to cure it. It's not going to treat the underlying problem. It's not going to make the bone heal. It's not going to grow cartilage back. But, could get massages on their knees every day if they have arthritis, it would help them.
Yeah. Even Theragun, down in price. I have one at home. I forget that I have it sometimes, but I
So
do like to
explain what
use it.
that is to people who don't know what it is.
So a Theragun is a handheld massage. It kind of looks like a gun that has different speeds and different attachments and allows you to go soft up to a very stronger intensity. And you can sit there and you can actually massage yourself. I think they work really well. They used to be fairly expensive, but like with all technologies, get them, now and they're really good. One of the companies that we partner with for our BFR cuffs actually sent us, they designed these silicone ones that actually can go over bone and things like that, that we've been using in the clinic, and a lot of patients really like those. And
Nice.
one other thing, people can have a masseuse on call for when they wake up and when they go to bed. But things I like to tell patients is when you wake up in the morning, that's a good time to do some dynamic stretching, right? Because you're going to be moving throughout the day, and that gets the blood flowing, that gets you going for the day. And then at night, before you go to bed, when you're going to be in certain positions for prolonged time, the more static stretching is actually better. So you can't get massage, but there are some stretching techniques that you can use to kind of help along as well. All right. Are there any vitamin deficiencies that cause arthritis?
Well, I mean, vitamin D for strong bones. And there are certain vitamins, like vitamin C is going to help. I mean, if you don't have vitamin C, your collagen is going to break down. I mean, scurvy is.
Mhm.
Zinc is important. It's not necessarily a vitamin, but it's minerals. But I mean, if you eat a well-balanced diet, you shouldn't have to worry about that, right? Having said that, not everybody does that. So it's something as simple as just taking a standard multivitamin per day is going to be fine. You'll have enough. You don't have to overdose on vitamins, and so deficiency can lead to issues with collagen production, with hormones, with healing ability, all these things that can make your arthritis worse. But a well-balanced diet is going to be almost a non-issue. And even if you're worried about that, taking a one multivitamin a day is definitely going to be a non-issue. So I think the question's more, do people need to, because people always ask, should I take, dose vitamin, dose C, or high dose this and that? And there's no definitive evidence that taking macro doses is going to, again, make your 81-year-old knee look like you're 18. So you don't have to go crazy on it. A good diet's probably good enough, but if you're worried, one multivitamin is going to be fine. But there's not too many people getting scurvy nowadays. For that on the British sailors, they would go and they would eat salted meat, and they wouldn't have any vitamin C whatsoever. And then they finally figured out, hey, if we bring limes or lemons or oranges, but that's why they're called limeys. If you bring limes on the ship, because the limes actually they don't break, like an orange is gonna kind of, we call it, rot faster than a lime, by the way, or a lemon. So anyway, yeah, as you get enough vitamin C, your body's not going to break down. But literally, they would, if you don't have vitamin C, your body's going to fall apart. But that takes a lot to get to that point of deficiency.
Yeah.
And B vitamins are important for metabolism. I mean, vitamins are important, but well-balanced diet and or multivitamin once a day, and you should be fine.
What about all these new collagen supplements, right? Like
Yeah,
the average person's like, oh, I mean, do that. I'm gonna rego cartilage, or
yeah,
I'm gonna.
yeah,
So can you expound on how
absolutely.
that works?
So again, collagen is, there's like I think 28 types of collagen. There's six kind of and really two or three main types. Type one is the type of collagen that really is our building blocks of almost our whole body. Type two collagen is more prevalent in cartilage, so it is very important for articular cartilage. For instance, the cartilage the on the end of a chicken bone cartilage, the tread on the tire. So collagen is needed, but you can get that by eating lots of different foods, including meat for sure. Meat has tons of collagen in it, every type of collagen you could ever imagine. But hydrolyzed collagen, because you hear about this a lot more too, it's like digestible and supposedly more absorbed into the systems. And there are some studies that show that maybe just like glucosamine chondroitin sulfate, for instance, we might as well broach that topic as well. So yeah, is collagen in our cartilage or in our bones in our knee? Absolutely. Is there glucosamine chondroitin sulfate? Absolutely. Glucosamine and chondroitin sulfate are part of the matrix, or the white part of our bone. as is the collagen, and our cells make that. So supposedly by eating glucosamine chondroitin sulfate and or collagen, you're going to grow back new cartilage. No one's ever proven that in humans. But there is some evidence that it may protect the cartilage you have left and or make you feel a little bit better. But again, if you're eating if we know what your genetic based diet is, the right diet, if we know what it is for you, then you shouldn't have to take all these supplements and all this stuff. There may be a few things because, like, even me with genetics, they found that a certain type of vitamin folate, I don't absorb well.
Mhm.
So there was a suggestion that I might want to try this liquid supplement to help, or eat a lot of, I mean, a lot of greens anyway, and there's folate in there. But I have to eat more than the average person based on my genetics. And so that's where you might get from your genetic report, maybe it is good to supplement a little extra of this, or it's a different form of folate. It's a form that is more easily digestible for me. It's a liquid form.
Yeah.
So the glucosamine chondroitin sulfate, the collagen, all those things, they can probably help some. They can be expensive, and you might not even need to spend that much money just eating a well-balanced diet. And matter of fact, we figure out your genetic diet, you eat regular foods, you don't buy the supplements, you probably save yourself 50 to $100 a month, multiply that times 12, right? So people are spending a lot of money on stuff that's not getting, the as much benefit as they could get just from actually figuring out what the best diet is for them to eat. And then I always tell people these are supplements. These are not regulated by the FDA like drugs are. So you never 100% know what you're getting. There are some, brands out there that are common and have been around a long time. So but I always tell people to ask their pharmacist what they think a good brand is. Even that, I think there's so many different brands out there the pharmacist can't always tell you. I mean, I my own biases on what I think is good or not good, but they are supplements, and you never 100% know what you're getting with a supplement.
Yeah. Especially when it says proprietary blend.
Yeah, yeah,
Not know anything that is in that blend.
right.
Yeah. All right. One last question. Ankle arthritis. Walking, is it good or bad for it?
Well, ankle arthritis is just like knee arthritis, is just like hip arthritis, any arthritis in your lower foot for that matter too. Anything in your lower extremities. Movement is good. Okay. So if it's not causing your ankle to swell up, become stiff, give you pain, other than a little soreness from exercising that may go away after a day or two, if it's making your pain a lot worse, then it's probably not the best exercise. But that also might mean there's other factors involved that if your Achilles tendon is too tight, or your hip has an issue, or your back, and it's causing you to walk abnormally on your ankle, if we correct that, alter the mechanics at your ankle in a positive way where you won't have pain. So it's hard to just say, oh, ankle arthritis, because as I knew, no, the ankle is connected to the knee, is connected to the hip, is connected to the back, upper body is connected to our lower body. And so we got to check out everything. That's where our VFit experts like you come in. Like you are gonna just immediately focus on that ankle. Matter of fact, they're gonna be like, why is he looking at my hip? Why is he looking at my back? Well, we're trying to figure out, have a problem in your ankle. You might not actually either, but even if you do, there's other things that are contributing, and we might be able to get you back walking, even with quote arthritis in your ankle or arthritis in your knee or your hip, because who doesn't like to walk, right? Plus, we all have to walk, but walking is great exercise in general. But if it turns out all those other imbalances were fixed and you have really severe arthritis in your ankle, is walking the best exercise? It might not be, because you might need to get back into the non-impact loading stuff we were just talking about. Swimming, swimming in a pool, water running, a bike if you have enough range of motion, right? Because that, maybe, but you are weight bearing with the elliptical. So you need to do non-weight bearing strengthening exercises. There's plenty of those that can be done. And so first we want to make sure it's quote just the ankle only, right? And then try to correct any other areas that may be contributing to that ankle problem. And then decide whether or not walking is the best, reasonable exercise. Still, I would say 9 times out of 10, even with quote bad arthritis, we can get people back walking without much pain and getting them doing the things they want to do. Sometimes they might not be able to walk as long, want to walk 3 miles a day. It might end up being 1 or 2 miles every other day to give their ankle a break, the bike on the off days. So if you really like walking and hiking, which a lot of people do, we'll work with you on that. But
Yeah.
that just brings up, says ankle well, let's check everything else out first as well.
Yeah, I know, that just brings a particular member that we have, we're seeing now, right? They had severe arthritis in their ankle. And, to walk, they walk on uneven surfaces, they take their dog for a walk. And, with this individual, they did PRP, they did BMAC, they did laser, they did VFit, right? And all they wanted to do was get back to walking, right? We got them doing that and much, much, now into actually working out. They like coming to us. They like, their body gets stronger. It's what I come to work for, right?
It's
That's
very
all.
fulfilling. And with the traditional insurance model, only spend 7 to 15 minutes with a patient. You're never going to get what we just talked about with you. If you were only allowed to see a patient for 20 minutes, it's
Yeah,
not going to get that. You're not going to get them the level of satisfaction they need, or you the level of satisfaction, job satisfaction. And by being outside of the insurance world, we are actually able to empower people. I mean, our goal is to get them better so that they can do this stuff on their own for the rest of their life. And it's hard to do that with the current insurance model.
it is. It is. And like you said, people have we seen they come for an issue and it ends up being the back. It ends up being something else. A lot of weird looks when somebody is in the clinic and they're there for their knee or their ankle,
Yeah.
and I start with the lower back and they're like, I
Yeah.
have no back pain.
Yeah.
But you move it, you bend it, and
Yeah. You have
all of
to
a
have
sudden
pain
she'll
in your
change
back
it.
to have it affect your legs.
Yeah.
And the sadder thing on that, I know we only got like a left, but this thing is that insurance would say, no, you can't treat that person's back, even though that's what's part of what's affecting their ankle.
Because you don't have a
You
script for it.
Yeah, or you just if it's like workers' comp, no, you can't treat that.
Yeah.
You can't. They'll like no, only quote injured their ankle. You can't treat anything else that's going to instead of saying, hey, whatever can help that ankle get better and get that person better faster. No, you can't treat those other areas. You only have to treat the ankle. And again, a lot of things other than the ankle that can cause ankle pain.
Yeah. Yeah.
If you
And
injure your ankle, let's correct those other things that might be contributing too.
yeah. Is the glute med making you have a valgus and it's putting more load on the ankle and the knee? Like there's so much. I mean,
Yeah, it's what he just said there, just for you all to know. Is the hip causing a problem with the knee, which is causing a problem with the ankle? That's what Andre just said in medical terms. And that it's the truth.
yeah, yeah. Go, I mean, a 2 hour talk, right? Of
Yeah.
all the things that
Well,
we
we
know.
got time. We'll be here every week live. Man, you did a great job filling in for Adam. Maybe just lost his job. No, just
No,
kidding. But we got a great team here, and everybody just proves how everybody can fill in. Carl filled in for me last week, and that was great.
yes. So
Awesome.
awesome. All right. That's all the time that we do have today, Doc. I
Okay.
know other things going on in the clinic. I just want to thank you
Yeah.
for the time out, sharing your vast knowledge with us. And I also want to thank everyone who joined us this morning for watching. If you are watching this later on like YouTube, if you look in the description down below, you can join our Skool games. Got a problem with your knee? Ask Dr. P group. There you can ask some questions. We'll answer them live every Wednesday between 9 a.m. and 10. You can also follow us on social media. You can a Facebook group called Knee Repair, Not Knee Replacement, where we also put up more content about knee pain and things that you can do to help alleviate that pain, or get in with a CDE with us and see what's really going on, and we can help fix that too.
Yeah, so I would say I agree with that because like if you join, there's other benefits to joining and if you do join the community, then we can get you in much quicker and take care of you much quicker. And it's all about time. People have a lot of time and they want to figure out what's wrong fast instead of over months and months and months, which it takes for insurance. So if you join our community and you want to get in or be evaluated, and we do a lot of telemedicine too, we can get that done a lot quicker for our
Yeah,
members who join.
definitely. Definitely would love to see you guys because we would love to. We're just trying to help as many people as we can, right? And try to get everyone moving again.
There you go. Movement is medicine. On that, we will end. Thank you, Andre. Awesome job. And thank you, everybody,
Thank
for
you,
being
Doc.
here. And we'll see you next week.
Have a good one.
You
Bye.
too.